retired 5 years ago. I spent the last 5 years teaching medical students at UT Southwestern in Dallas Park. The question is, how should medical care that we give to the uninsured and the undocumented folks, how should it be reimbursed? Currently, docs just don't get paid, and hospitals pass those expenses on eventually to...
First of all, I think it's what you do as a doctor, and despite what other people might say, I think your motives are good, and you try to help people. Not prescribe unnecessary procedures just to make money, but at the same time, I don't know that I have an advanced answer for you, but I can get you an answer. As far as how they would be reimbursed, I don't know. Under the administration's plan, I think it's the taxpayer that ends up subsidizing almost everybody. So, but I can get you more detail.
I just think it needs to be accounted.
You're right.
Mr. Congressman, we have a young lady over here who has an odd number. Could you possibly take care of her?
Well, actually, half the people I've called have odd numbers, because I've been doing 5, 10, 15, 20, and so forth. But we'll be going back and forth. Yes.
Thank you, sir.
Good try.
Good try. Folks on the other side about the rising cost of healthcare costs. My general question is, why has it taken so long for our elected representatives to tackle this issue? Why has it taken so long?
They're too busy trying to get elected.
Representatives in Congress, the president, our local officials, everyone to tackle this health care issue. We are the greatest nation in the world, and yet we cannot solve this problem. We have a president that we duly elected legally that is willing to tackle this problem.
I don't know about legally.
We might not like the way he's doing it, and therefore we have these town halls, which is a good thing. But we have to solve these problems, and my fear is that if we let it go, it will not get solved.
Okay.
It ain't gonna get let go.
This is a problem that needs to be addressed. We shouldn't ignore it. But as I mentioned earlier, there is a bipartisan solution that can pass next week. The problem is there's too much partisanship. The problem is that there is not enough willingness to make it a bipartisan solution. I've outlined a few minutes ago 4 areas where I think there is general agreement. That would take care of the immediate problem. It would take care of the people who are not insured. To me, that would be a good way to go.
Thank you, Congressman, for giving us the time, and I appreciate all that you've done for us. I'm also a small business owner as well, and I'm also battled with the rising costs of the insurance premiums, not only for my employees, but for myself personally. I pay about $1,300 a month. That's pretty steep. But my question is, and I also agree, first of all, with tort reform and also competition as far as the free market. We really need to get the premiums down. This morning, Senator Schumer stated that if we don't come back, y'all don't come back from the recess and vote on it, there's not going to be bipartisanship on this, they're going to exercise the nuclear option. So what is it for us? What do we expect if that nuclear option is imposed? What does it mean for we the people?
Good question. Senator Schumer, senator from New York, basically it's a negotiating ploy. It's part of the game. If we don't sign up and support this, quote, the Democrats are going to go along with the nuclear option. The nuclear option is basically changing the rules. And instead of having to get 60 votes for a piece of legislation, which you need to get to break the federal filibuster, you can pass something with 51 votes. Done as a part of the budget process. It's not done very often. My reading when I saw that was it is a threat, but it also says something that is a little disturbing, which is that we don't need bipartisanship, we don't need a consensus bill, which we could easily have. All we have to know, compromise is both directions, not just one direction. And I think he would like to do just one direction.
How important is this? Why can't the vote be to the people? Why can't we vote on it?
That's a great idea.
Why is it we have to have
for it. They're getting to vote for it, that gave me a great idea. At forums like this, they're getting to vote for it at elections, and so you're absolutely right. But something I haven't done that I'm going to do right now to give you a great idea, we're going to have a vote right now. And a show of hands before we finish up on these questions. And the vote is going to be very simple. Do you favor the proposed health care plan, HR 3200, or do you oppose it? All in favor, raise your hand.
They're all in one spot.
Favor of the health care plan, HR 3200, raise your hand. Okay, all opposed, raise your hand. Thank you, that's helpful, good to know. Thank you for giving. We'll go to lady right here.
A little short, I hope they hear me. My name is Isabel Morvain Oliver, and of course I'm retired, as you can see. Anyway, how dare Congress borrow money from Social Security and Medicare and then say we're broke? That's theft of services. I paid my money in all my life, ever since I was 14, maybe on up, and if they borrowed from it, they owe me back. Why don't they, instead of cash for clunkers, I am an old clunker.
Sneaky way to get a vote. A lot of people didn't raise their hands, some did, but remember, a lot of the people that are not here are your working force, which are for public reform. So thank God I'm 94, I was able to retire. Like some of you in here are already retired and are already reaping benefits from Medicare and Medicaid. But I'm here to ask this particular question. Since insuring everybody in the United States, and it's down in the long run, and it's going to, and being able to provide health prevention, medical prevention for people, why are you so against it if it's going to bring increase down the road for our younger children who are not able to be here today? Our younger people.
Y'all stand up. Y'all stand up. Stand up.
The health care, medical insurance. If the insurance, right now, we can medically insure everybody.
Made 2 points. The second was that we want to make sure we cover children. And if you oppose HR 3200, that doesn't mean we don't want to cover the children that don't have insurance or the families that don't have insurance. My point is that the number, the universe of people who needs health care insurance is not really 46, 47, 48, 49 million people. It's closer to 10 million people. And if they are children and families, they should be helped if they can't afford it. They should be covered. So I agree with that. As far as the people working, 85% of the American people who work have health care insurance. I want them to be able to keep it if they like it. And so
That's right.
My other question is that, and this really bothers me because we keep saying we don't want government to take over our health insurance. My question is, I was always taught in civics in school that we are the government. So if we don't take over and make decisions for who we want, and why are we separating us from government? I have a problem with that.
They've done it already for us. They separated themselves.
Ray made a good point. She said, we are the government. That is true. We're the ones who should be determining what kind of government we have, what the government spends, what kind of policy we have. So on that, we have 2 more questions over here. Yes.